How you doing, guys? This is Dr. Sun at Specific Chiropractic. In this video, we're going to talk about hard flaccid syndrome in terms of what it is and also how we're going to take care of it. All right. So we have a gentleman over here. He's been suffering with this problem for the past 2 weeks, where he describes where it feels like when you're like walking day-to-day activities or what have you, that his plumbing equipment, it's like it's supposed to be normal, but instead it's like a partial hard-on in there. Okay, it's partially erected and it's uncomfortable. And when it comes to actual doing the relation business over there, okay, it's also a similar story as well. You cannot go fully all the way, but it's also not fully drained out either. So a urologist gave him Cialis. It helps somewhat, but not really. Okay, so we're gonna take a closer look, see what's going on, and take it from there. Here's a story with any type of dysfunction in the plumbing department. Okay, here's an old mnemonic we learned in school. Right, 2, 3, 4 lifts a Johnson off the floor. So what's the 2, 3, and 4? It's these sacral nerves over here. Right? So if there's any type of irritation where the nerves are not functioning properly, it may result in due to that plumbing department. Because, as you see over here, issues here, issues over here, right? So we're going to investigate what's going on with those sacral nerves. So as we went over on the neurology aspect of it, we want to investigate what's going on with the sacral nerves themselves. So on this x-ray, when I'm looking at all these segments over here, I already see a very enlarged posterior open gap right here between the first and second sacral segments. So this is already one potential candidate we're going to confirm on you in the x-rays. But also it looks like there's a very old injury over here at your fourth sacral nerve a long time ago when you were a little kid because of how it ossified. This should be nice and smooth, but nope, it's the way it healed up. So we're going to also take a look at that potential fella as well. Okay. Other components, this is for a future visit as well. Your foundation is sinking down on the right hand side. So we're going to triage this first because clearly you're here for that plumbing department issue. We're going to address those neurological problems first, but in future visits, biomechanically, we need to start leveling this up over here and figure out what's going on with that potential right hip over there. And what that's going to do is it's going to help take a lot of this twist out of your spine over here and also combat other neurological problems you're talking about as well. Okay. So as you viewers can see right off the bat, there's a lot of pulling, a lot of fluid going on over here. So, and we lower this down over here. We're checking things. See, it shouldn't be this puffy, this swollen. So we're talking about there's something very chronic. This has been here for quite a while, and it's more like the final straw broke the camel's back. It really irritated some kind of nerve around this region and may present that problem. So checking over here. Yeah. See, it's a huge speed bump right over here, right at the second sacral nerve. I'm sorry, that second sacral segment. The 4 actually is not that bad. I don't find anything there. With this instrument over here, we want to look for these potential issues. And see that reading right there? See, there's a small little reading. It's just going 2 points to the right at this level right here. And we're scanning down below. See, there's nothing at that 4. It's just this 2 that's lighting things up here a bit. See, the 4 is moving, 3 is moving. See, 2 is stuck right there. It's not moving. See, it's moving too much on this side. That is fine right here too. Isn't it right there, sir? Yeah. See that fella right there? That's just not moving too well. That's the candidate right there. Okay. So we confirm once again. See, this is one big. It's like a grapefruit-sized swelling. Right there, it's all pulled up. So I'm going to set this poor fella in place. Drop the blade again, sir. Right there, and oh! Alright, sir, so here's the story. The adjustment went very well. I need you to put a cold pack where we adjusted on you. 20 minutes, 3 times a day. As the swelling calms down, all right, I want you to report back to me on the next following visits how the plumbing department is working. All right? Okay, we're all set, sir. Have a good day.
Thank you.
You're welcome. Welcome back, all right? So for our next update, give us the latest updates. How's everything proceeding so far?
About 50% better.
All right. Hey, that's a great update right there. We'll continue working on it, all right? Thanks for the updates.